a good seal by placing your palm over the filter opening and inhaling to ensure no air is coming in around the facepiece. Now grab the back of the hood. Pull it over your head and shoulders and tighten the neck hood drawstring. Then fasten the underarm straps to secure the hood in place. If you are exposed to nerve agent, you must use the antidote immediately. It is called the Mark I kit. You only use this kit when you are experiencing the two primary symptoms that only nerve agent will cause. These symptoms are dimness of vision or pinpointing of the eye pupils, and jerking of the muscles, followed by convulsions. You will be issued 3 Mark I kits. Each kit contains 1 atropine injector, the small one, and 1 2-PAM chloride injector. These 2 injectors fit inside a plastic safety cap to prevent accidental firing of the injectors. Caution: once removed from the safety cap, touching the injector end may fire the needle. There are 2 injection locations on your body. First is the middle upper thigh muscle. You inject from the side through the top part of the muscle. This prevents the needle from hitting the bone. Second is the back high side of the buttocks. This location ensures the 2 main nerves running up the back of the leg and buttocks are not damaged by the injection. Now that you know the 2 locations to administer the antidote, we'll go through the administering procedures. If you have symptoms of nerve agent poisoning, you remove the Mark I kit. With your non-dominant hand, hold the plastic clip so the large injector is on top and at eye level. With the dominant hand, check the injector site, thigh or buttocks, for buttons or objects in pockets which may interfere with the injection. With the dominant hand, grasp the atropine injector, the small one, with the thumb and first 2 fingers. Caution: do not touch the needle end while removing the needle cap. Pull the injector out of the clip. The injector is now armed. Do not touch the green end to any surface except the injection site. Push the injector until the needle fires. Leave the needle in the body for 10 seconds and remove. Place the used atropine injector between the little and ring fingers of the hand holding the Mark I kit. Watch out for the needle. Pull the 2-PAM injector, the large one, out of the clip and inject yourself in the same manner as the atropine injector. Remember, the black end is the needle end. Remove the injector after 10 seconds. Attach both injectors to your clothing by pushing the needle through the pocket flap and bending it to form a hook. Pinning these injectors to your pocket will tell medical personnel how many injections you were administered. If symptoms of nerve agent poisoning remain after 10 to 15 minutes, seek someone else to check your symptoms and administer the second set of injections.